Thank you. It's the first time I've ever followed a Nobel laureate. I'll give this a try. Coming to Hyderabad is like coming home for us. As many of you know in this audience, Hyderabad is the home of the Providence Global Center. We've been in Hyderabad now for 4 years, and we are the first health system in the United States that has established a presence in India, in Hyderabad, particularly for information technology and the concepts around AI and data. Today, we have 1,400 caregivers in Hyderabad. Yesterday, we were glad to dedicate our new headquarters here, and we look at the future in exponential growth in Hyderabad. We consider Hyderabad and Providence, India, as important as Providence, California, or Providence, Washington. Our hometown, so thank you so much for everything that we have here, and we look to a bright future as we go forward. Our home headquarters is in Seattle, Washington, which in a lot of ways has a lot of similarities to Hyderabad. We're the home of Microsoft. What's that other company that starts with an A? I think it's called Amazon. So we are used to living in a high-tech hub, but we very, very carefully selected Hyderabad, and two of my colleagues that are with me today have been in India, in Hyderabad, for 20 years. And they did the initial work to get Microsoft started here in India, and they've done a tremendous job for us at Providence. What we're looking forward to in the United States, I'm the past chair of the American Hospital Association. In the United States, we have 5,000 hospitals, and probably, I would say, about 800 to 1,000 health systems. What we're looking forward to the future is bringing partnerships of other health systems to us in India. And we've already started with one, Advent Health, that started, but I can tell you there's a lineup of my colleagues in the United States that want to be part of what's happening in India. So why India, why Hyderabad, and what's the transformation? So healthcare, like in India, is a little bit chaotic at times. I represent the delivery side of healthcare. So we're situated in the western United States, and we have hospitals, 52 hospitals from Alaska to Lubbock, Texas. We have over 1,000 clinics, and we have 121,000 caregivers in the United States, and we service anywhere from 5 to 10 million patients in the U.S. About 8 years ago, we said we need to transform our own healthcare system and healthcare. And we needed to go from just a patient care delivery system to an information and services company. So we figured out we couldn't do it alone, so we started hiring people from Amazon and Microsoft and other tech companies to help transform our organization. And one of the first things they said, we need to broaden our scope of computer engineering, and that's why we're here in India. But more than that, we really needed to become a data and analytics organization. So last year, as we've left COVID, we called last year at Providence the year of human connection. We stopped getting behind our screens and started to get back together like what we're doing today. But this year, we declared, and going forward, for Providence and for healthcare, it's the year of transformation and collaboration. Transformation and collaboration. Healthcare needs to transform. The delivery side needs to transform. And how are we going to do that? We're going to do that through the tools of AI and data. So Providence started on a journey to digitize itself and to become a completely digital company, which I would say over the last 5 years, we're almost there. In addition to that, we said that as a healthcare organization, we need to diversify our portfolio. So today, we're a services company that implements electronic health records in Great Britain, in Western Europe, and almost every state in the United States. So a lot of times when a new electronic health record is going on, our people are doing that work as we go forward. The second thing that we said is that we need, data is chaotic in healthcare. And we were not willing to allow our friends at Microsoft and Facebook and Amazon to take our health data. So what we did is said, let's get the health systems of the United States together to create our own data company. Today, Truveta is about 3 years old. It has over 35 health systems that are contributing all of their healthcare data to one point. The power of this is immense. So we account for anywhere from 12 to 15% and growing of all healthcare data in the United States. The importance in terms of biomedical research is that database is incredibly diverse. So it has everything from Hawaiian Islanders to people living in South Central Los Angeles to people that live in Alaska. That kind of a database is critically important to our friends in pharma who are looking to unlock unique properties for medications that they have. Amongst that is almost limitless. The United States government has started to ask us about our data and how we collect it. And we think this is going to be a revolution in the way we do it. But what's critically important is it's data owned by the people that actually do the work and take care of the patients. And we have been tremendously successful in that. In addition to that, we created an organization called Tegria, which enables us to provide services to other hospitals all around the United States and ultimately around the world and particularly in Europe as we stand now. So we've really diversified our portfolio. In addition, we talk about the 6 Ds at Providence. Digitization, diversification. Then the third one's a little controversial, deconstruction, which means we take the health system apart and decide which components are the most important, which ones have value. Today, Providence, in addition to its 52 hospitals, 1,000 clinics, 120,000 caregivers, we're in supportive housing. We have our own health plan. And we even have a high school in Burbank, California. And all of my investors ask us, why did we hold on to a high school in Burbank, California, Providence High School? And when with our investors, they say, we need to know what 14 to 16-year-olds are thinking. And it's really our laboratory to understand where the future is going. We were started 170 years ago in the territory of Washington in the western United States. That tradition, we've always changed, we've always innovated as we went forward. And our saying at Providence is that we exist at an intersection between compassion and innovation. Last year, we did over $2 billion of free care, community service in the United States, in addition to being a $28 billion healthcare corporation. We're looking at the collaboration amongst healthcare systems to really solve some of the problems that we have in the United States in the development of care. So those are the first 3 Ds. Well, what else is there in other Ds? The other D is the delivery of care. We're looking at the scientific way that we deliver care to decrease technologically the burden on doctors and nurses. So today we have a co-caring model of nursing so that our nurses in our hospitals and clinics literally have partners that are on their computers at home doing some of the work along with them. So we look at that as a way to make the difference in healthcare, and we look at things like telemedicine and all of those techniques to really revolutionize the D, which is the delivery of care. What's the 5th D? Diagnostic and therapeutics. If you have any doubt about that, you heard from our first 2 speakers. I've been a physician for 45 years, and we've seen just a dramatic change in what we're able to do. When I started in practice, we kept a total hip replacement in the hospital for 2 weeks. Today, we do it as an outpatient. One of our surgeons operated during COVID on a patient in London from his robotic surgery platform in Seattle, Washington. Seattle operating on a patient in London. So the delivery of care and how we do it and the diagnostics that we use are just going to be remarkable. I'm on the board of GE Healthcare, so very, very interested in the diagnostics that we use in CT scanning and others that make such a difference in our ability to diagnose and care for patients rapidly and thoughtfully. I would never think today what we're able to do 45 years ago in terms of what we're able to offer patients. The last D is probably the most important. I cheat a little bit. It's data and artificial intelligence. So today, Providence has a whole group of folks that do nothing but think about the applications of artificial intelligence. One of the things that we've done, which is different than others that are dabbling in artificial intelligence, is we've said, how do we apply AI to make clinicians and nurses smarter and have less burden? So what's the biggest problem today that most physicians have on the front line? They have an electronic inbox that is this big. And they spend most of their time trying to answer electronic questions and everything else from their patients. Many of us send our questions on our iPhones to our physicians. Well, we've used AI to basically empty the inbox for physicians. So using bots and using artificial intelligence, we triage what the questions are, what has to be answered, and most importantly, who has to answer them. We're also developing AI techniques that can give physicians the answers to complex questions at the point of service, something we call Pearl, which enables clinicians to really have the information that they need. When I was back as an intern and a resident a few years ago, I had everything in a book in my pocket. Today that, I can listen to it in my ear sequence to understand what are the choices and what are the things that we have to do to make patients better, faster, and smarter. Today, we don't read an EKG. It's read electronically for us. Most of you have a watch and you're checking your own EKG as we go. We believe that through AI, things like making sure that CAT scans and MRIs are read the right way, this will become commonplace. And we need to use these techniques to make care smarter and better. We need to take the average physician and turn them into the superb physician. And that's where we really see this exciting interface between technology and healthcare. When we first started hiring technology people at Providence, technology people did not understand healthcare people. Healthcare people did not understand technology people. So we had a Venn diagram, and we had them both here. When you put the two together, that's where magic occurs. So we brought in our folks from Microsoft and everywhere else and sat them down with our clinicians, with our scientists, and with our administrators. And I think that's the secret sauce, to understand how technology can work practically and how data can be used to accelerate what a healthcare system can do. And that's what we believe. Today, we think there's going to be further consolidation of the health systems. We're talking to health systems in India about what they're doing because we believe there's commonality in the problems that we're solving. When we had COVID first hit, we had the first patient who had COVID in Washington State back in 2020. Within one day, we were on the phone with our colleagues in China and in Italy to understand what we needed to do with our patients. And that sense of collaboration is something particularly for us is going to be critically important as we go forward. But we're looking at consolidating all the business practices of healthcare systems in the United States together. So I pose the question, why should every healthcare system in the country and the world have their own cybersecurity? It makes no sense. In order to combat what we need to do on the cyber side, we need to do this together. So we believe things like information technology, cyber, data, actually even finding the right people to work at our hospitals and clinics are things that we should do together as a group of health systems. So we'll be announcing within the next few months what we call the Health System Collaborative, HSC, which means these are health systems in the United States that have said, we're going to look at the whole back office of healthcare and drive that together, both to do it less expensively, but better. So, our vision, as you can see up here, is health for a better world. We look at ourselves as not just a United States-based health ministry, but an international health ministry. And we feel that one of the keys to our success and the success of healthcare in the United States is going to be our commitment here in India with some of the smartest IT technology people we have, and that collaboration. So thank you so much for having me here today.
To stay informed about the startup ecosystem, subscribe to My Startup TV.